It can be rheumatic valve disease, congenital valve disease, or it could be degenerative valve disease. So what do the patients with valve disease present to us? What are the symptoms that they have when they come to us? I think that's what you're trying to understand. People with valve disease usually come to us complaining of either breathing difficulty on exertion, it's called exertional breathlessness, or they can come to us with chest pain or with rapid heart palpitations, or they can come with episodes of giddiness or blackout, which we call syncope. And these are the different symptoms with which a patient with valve disease can come to us. And once a patient comes to us with any of these symptoms, we investigate the patient for valve disease. One is we start by doing a physical examination. In a physical examination, we often detect the signs of valve disease by the presence of a sound called a heart murmur. There's a rumbling sound inside the heart when we auscultate with a stethoscope that we call a murmur. So the presence of a heart murmur usually indicates the presence of a valvular heart disease. And once we detect a murmur in a patient, we subject the patient to further investigations in the form of an echocardiogram and an electrocardiogram. There are two types of problems that can occur with problems with valve disease. It could be either the inability for the valve to open completely, or it could be an inability for the valve to close completely. In the previous instance, that when the valve is unable to open properly, there is obstruction to blood flow across the valve. That is called valve stenosis. And if the valve is opening well but it's not able to close properly, there is leakage of blood across the valve. That is called valve regurgitation. In many situations, there is a combination of both valve stenosis and valve regurgitation.